If you are currently enrolled in a Premera Blue Cross Blue Shield Medicare Advantage plan, there's some crucial information that you'll need to learn about for this upcoming Medicare annual election period. Unfortunately, Premera Blue Cross is ending its Medicare Advantage plans across the state of Washington. This will affect roughly 32,000 people in the state. Now, I need to emphasize that this only affects their Medicare Advantage portfolio. This does not affect their Medicare Supplement, or also known as Medigap members. So if you have a Medicare Supplement or a Medigap plan with Premera, then those plans will be the same going into 2025. Those of you that have a Premera Blue Cross Medicare Advantage plan will be forced to go back to the marketplace to try to find a new plan that will start on January 1st of 2025. So your current Premera Medicare Advantage plan will still serve you through the remainder of 2024. This change takes effect January 1st of 2025. Every year, all Medicare Advantage insurance companies are required to send a statement to all members letting them know of plan changes and or plan termination. So historically, people receive these notifications and they simply disregard these letters or throw them away. So I highly recommend keep an eye on your mailbox to receive this information to confirm the information that I'm about to share with you. The Medicare annual election period runs every year from October 15th through December 7th. That is the time that people can shop and compare plans. So I would highly recommend that you utilize this annual election period to find a replacement for your Premera Medicare Advantage plan. Hi, I'm Mark Prip with Policy Guide, and I've been teaching people about Medicare for the last 15 years. I will provide you all of the resource links that I'm gathering this information from so you can review that for yourself, and that also proves evidence of these changes that are to come. This statement is taken from an article that I reviewed on PR Newswire. You can see I linked it in the description below, but this is from the Premera Blue Cross CEO. It says, "This was an incredibly difficult decision, particularly given our position as the only local commercial health plan in Washington and our commitment to serving our community. Despite our best efforts, the challenging market and financial constraints have made the long-term success of Medicare Advantage program unsustainable. Through the remainder of 2024, our commitment to our Medicare Advantage members is unwavering. We'll continue to ensure that they receive excellent service they have come to expect from Premera Blue Cross." I also went ahead and went to the Premera Blue Cross website and took the screenshot. Basically, right there on the Medicare Advantage page is a bold statement letting current policyholders know when they visit the Premera website that they see this change in bold. It says, "Premera Blue Cross has publicly announced the company will exit the Medicare Advantage market as of January 1st, 2025. Premera will no longer offer Medicare Advantage plans. All existing Medicare Advantage members' coverage will end December 31st of 2024. And again, as I said at the beginning of this video, the Premera Medicare Supplement plan members will not be affected." Why is this happening? Obviously, I read you the statement from the CEO, but that was kind of vague and generalized. I recently covered Aetna dropping upwards of 400,000 people across the United States. I did the same video for Humana, which is doing the exact same thing. They're not leaving the market, but they're making major reductions in many, many states. Let's look a little further at what Premera is saying. Premera Blue Cross, a leading health plan in the Pacific Northwest, announced today that will no longer offer Medicare Advantage plans starting January 1st, 2025. This strategic decision is influenced by changing market conditions and financial pressures. By exiting the Medicare Advantage market, Premera plans to redirect its resources towards other growing business lines such as employer-sponsored health plans, Medicare Supplement plans, and plans offered under the Affordable Care Act. This shift will enable Premera to invest in innovative solutions and programs aimed at increasing access to affordable health care. The bottom line is this: with medical loss ratios and the amount amount that these insurance companies are receiving reimbursement from the federal government is not sustainable, is what they're claiming. So we're seeing a lot of these smaller localized companies not able to weather the storm when it comes to the medical loss ratio. That basically means they're taking in this much money from the government and the reimbursement rates, and then they're putting out this much money in claims. I'm going to give you a few ideas of how to prepare and find a replacement plan during this year's Medicare annual election period. So if you want to find another Medicare Advantage plan, the good news is finding a replacement company won't be that hard. Make a list of your current doctors, hospitals, and medical providers, and a list of your current prescription medications, the dosage, and the name of those prescription medications. And here's why that's important. So when you go out to the marketplace to find a new plan, you want to find a plan that covers all of your medical providers and all of your prescription medications, along with a plan that's affordable and has benefit structures that are the most similar to your Premera Blue Cross Medicare Advantage plan. Unfortunately, losing your Medicare Advantage plans is quite frankly a nightmare, but because this is loss of coverage out of your control, it triggers a guaranteed issue right. This means if you've always wanted a Medigap or Medicare Supplement plan, but have been unable to qualify due to current medical conditions, those medical conditions are waived. So that means if you go from your Premera Medicare Advantage plan and pick up a Medigap or Medicare Supplement plan, those health questions will not be asked for your eligibility. So if you want that Medicare Supplement plan, now is the time where you can switch over to that. Medigap or Medicare Supplement is going to cost more per month, but it's going to be far superior coverage. You will not deal with networks. You will not deal with provider disputes between the provider and the Medicare Advantage company. You will not deal with prior authorizations. You will not deal with referrals. You will not deal with copays and deductibles. Again, your original Medicare will cover generally 80% of all Medicare costs. The Medigap or Medicare Supplement is going to come in and pay the balance. So here are my final thoughts. You're not the only ones that this is happening to. Just about every major Medicare Advantage company in the marketplace is making some kind of shift and change, and generally that is increasing cost shares on Medicare Advantage plan, or for you folks on the Premera Blue Cross, they're actually terminating the plan. I would highly recommend you keep an eye out on the mail. That will solidify all of the information I'm providing you, and then have all of your information ready to shop for another plan. Now, if you need help with this, this is where we can come in and do a needs analysis for you. We help you with those lists of prescriptions, get your doctor's list together, and then we look at what's available with other companies for the 2025 year. We can help you transition over into another plan. Obviously, the goal is to go without gaps in coverage. Once you find out proof from Premera, jump on the marketplace and try to find a replacement plan. If you have questions, comment below, give us a call. We would be happy to do everything we can to help you just understand more in depth what these changes mean for you. Thanks for watching.